Dr. Stefko, thank you. Welcome to these interviews.
Thank you for inviting me.
So, Dr. Stefko, we've had a chance to work together, but there's some things I haven't had a chance to really learn about you and talk to you about, and I'm excited to have a chance to do that. For one, I was, thrilled that you got your medical degree from the University of Pittsburgh. I think you're one of the first that we've interviewed that can say that.
Really? Go Panthers.
And I also, I'm impressed. Of course, you went to Johns Hopkins University as well. Maybe that's not quite as impressive as going to the University of Pittsburgh, but very impressive that you went to Johns Hopkins University. And so along the way, obviously you're very talented. You're a great surgeon. You're somebody that the department, everybody respects, for what you do. So you're very, very good at what you do. But at what point, and tell me some of the things that motivated you to say, I want to get into medicine and become a physician and make an impact that way. What were the things that really drove you there?
Well, I thought I was going to be a doctor as long as I can remember, because my granddad was a doctor and he went to Pitt Med, and I found his portrait on the wall in Scaife Hall. And he graduated in 1935, I think. And I always knew what he did because he was a neighborhood doc on the north side. And I thought what he did was the coolest thing ever. So when I was 7, he gave me his old microscope from medical school. And I just sort of assumed that was what I was going to do. And when I went to college, I got a job after college as a chemist and sort of worked in the lab for a while, and then decided I didn't want to make hazardous waste for a living and went back to med school. I wanted something that was a bit more service oriented.
Oh, it's a legacy, with your family. And
a little bit, yes.
Yeah, that's excellent. So now I know that you are doing a lot of very cutting edge procedures in terms of surgery and advancing care. I'd love to learn a little bit more about them, and if you could sort of tell our audience here some of the things that you're doing, in neuro-ophthalmology and oculoplastics.
So one of the big sort of pillars of my career is that I work with the Center for Cranial-Based Surgery, and the base of the skull is a place that you can't see, and there are there's a lot of really complicated real estate there. Diseases that affect that will often be dealt with by otolaryngology and neurosurgery, but ophthalmology is pretty involved. And over the past 10 to 15 years, we've worked together pretty closely, and we've also started approaching the skull base and the brain by way of the eye socket. And it leads to smaller craniotomies and sometimes faster recoveries. It can be done pretty cosmetically, and it's a really great part of the armamentarium to be able to treat any disease as it comes up.
That's fantastic. How many programs in the U.S. offer that kind of skull base, and in particular with the oculoplasty, approach for skull-based procedures?
That is a difficult question to answer. I would say when we go to our national meeting, the North American Skull-Based Society, the ones who have the biggest presence there are Pitt and Ohio State and Harvard. And there's also one of the neurosurgery graduates moved out to Stanford in California. Those are probably the biggest presences. And I think a lot of people may dabble in this, but we have a pretty strong record of doing many of these surgeries.
Yeah, we're pioneers really in the field of skull-based procedures. Yeah.
They absolutely are. The expanded endonasal approach was really driven here.
Yeah, I work with of course our otolaryngology team as well, but that is exciting, and certainly I know something that if you ever needed the services where you have tumors in a position which would be otherwise impossible to get to without really opening the person up, that's fantastic. So I'm sure that does make you, that's exciting. Now, I can assume that with this next question, it may go there, but you may surprise me. If I was to ask you what you're most proud of in terms of what you've accomplished professionally, what would you say that would be?
So you may be surprised, because one of the things I'm most proud of is sort of a professional family thing where my kids handle it very, very well when I go to work in the middle of the night or when I go to work on my first night of vacation, because they understand that they are my family and they are my priority, and I will always have a backup. Because if I go to work and take my time away from them, it's because somebody needs me, and somebody needs me specifically. And my kids are really good about that. They've been good at articulating that as long as they can talk. And I'm proud of that.
Yeah, well, you should be proud of that. And you know what? Your kids will be proud of that as well. And that's wonderful. Thank you. That's one of my favorite answers so far. So you are from the region. You said, are you from Pittsburgh
I am
originally,
from
or?
Pittsburgh. I grew up on the north side.
So you've seen a lot of changes in Pittsburgh and a lot of changes in the healthcare environment in Pittsburgh. Tell me, what excites you about what, we have going on at the University of Pittsburgh, maybe as compared to other places that you know about?
One of the things that keeps me here is the team of people that I work with. I have a multidisciplinary team in the Center for Cranial-Based Surgery. I have a team in my department that I work with, and I feel like I never have to go it alone. If I can't figure out what's wrong, or if I can't figure out the best way to approach it, I can go talk to somebody. And that's one of the things that kept me in academia. That's one of the things that I love about this area too, because since Dr. Sahel has come in, there's been pretty much an explosion in research. And I've gotten involved in a project with a few of the PhDs, and I love going back to my lab roots.
Tell us a little bit about that. What is the project you're working on with the research side?
So the project that I'm working on with Dr. Leah Byrne's project.
Mm-hmm.
And she has this great idea that she is going to keep a human eye alive.
Wow.
Now, if she can do that, it means that she can test things in a way that nobody in the world could ever do. And if you can perfuse livers and keep them alive, then why couldn't you do it with eyes, except that the eye is sort of more complicated. Mm-hmm. And the liver guys are not going to like me saying that, but it's pretty complicated. It's also neural tissue. It's an outgrowth of the brain. So she has been working for a couple of years on technically how to approach it. And we've gotten to a point where we are going to be trying this on organ donors and seeing if we can keep a human eye alive for a certain period of time so that things can be tested on it. And I think that's really exciting and a lot of fun.
Wow. And very exciting. And I have to say, very cool. I mean, I didn't realize that was one of the things that she's also working on. I know a lot about what Leah is doing, but that's exciting. So the department's going through a lot of changes, as you know, and it has been in the last few years. And of course, there's a new facility and other things that are coming down the road for you and for the area that you direct in neuro-ophthalmology and oculoplasty. Tell me what are most exciting for you in terms of where we're going in the future.
So my I'm going to go back to a previous question. My second favorite professional accomplishment is my fellows and my residents. And I always tell them what the guy who trained me told me is that you have the lifetime warranty. And I love that we continue to train fellows at a really advanced level. And I really think that the more we can attract talent to our department, the better we're going to be, because we're sending it out into the world.
Mm-hmm. Yeah, it is exciting. And we see that all the time. And certainly we're seeing extremely talented people come here. We're seeing extremely talented trainees come here as well. So I'm sure that's part of the fun for you. So, well, Dr. Stefko, thank you. This has been really fun for people to maybe get to learn a little bit more about you. And those, I know that the patients that I talk to who have benefited from your care are so grateful. So it's always good to give people a chance to learn a little bit about the people doing the work here. And thank you for sitting for our interview today.
Thank you for inviting me.
Okay.